Hello, my name is Dr. Lucia Cañes. I'm a board-certified OBGYN doctor in a private practice of gynecology in Hyannis, Cape Cod, Massachusetts. Welcome to my series of videos about HPV infection. In this video today, we're going to talk about how HPV virus is transmitted from patient to patient. My patients are always surprised to learn they tested positive for HPV. The most common question I get from them is, how did I get this? Of course, HPV is a sexually transmitted disease and is transmitted commonly by genital contact. But skin-to-skin contact is also responsible for the transmission of the virus. So even if it's not through a sexual intercourse, just a foreplay, oral sex, anal intercourse, of course, can be responsible for transmitting the virus. HPV is very contagious. It's easy for the virus to get inside the tissue, especially the delicate vaginal tissue. Unfortunately, the only way to test for HPV is through a pap smear these days. Therefore, the diagnosis can be established only in a female patient. Currently, we don't have any test for men. Therefore, we can assume that men carries the infection when the partner has tested positive for HPV. If a patient has a wart, usually can, by skin-to-skin contact, transmit the infection to a next person through a handshake, theoretically. Typically, the viruses that are responsible for creating warts in the system are in the group of the low-risk HPV. Therefore, they are not a major concern. We don't even test for low-risk HPV anymore. The only test we carry on with the pap smear is for high-risk HPV, due to the fact that risk HPV can create more serious complications and even cancer in the individual who is affected. Some patients are more at risk when contracting an HPV infection for complications and cancer. Those are the patients who have a weakened immune system or who are taking immunosuppressant medications to treat autoimmune illnesses such as psoriasis or Crohn's disease. This patient should be monitored very closely for complications and for also persistence of the virus in the system for a very long time. Please let me know if you had any question about this delicate tissue. You can always reach me at my website www.yourhpvmdcoach.com. Thank you for listening, and I will talk to you soon.